For more than 30 years, Susan Hill of Raleigh has been the focus of anti-abortion demonstrations like this.
Susan Hill is an amazingly courageous woman who's made it possible for countless women to be able to get access to reproductive health care and to exercise their right to choice that the Constitution gives to them.
Despite protests and death threats, Hill remains an unyielding advocate for a woman's right to choose.
I see myself as an aging social worker who was lucky enough to get into a new field in 1973 that no one knew about, no one really could have experience in, and that was providing abortion services. And 34 years later, I'm still able to do that, happy to do it, and it's been the best thing that happened to me.
Since 1973, when the Supreme Court's Roe v. Wade decision confirmed a woman's right to make decisions about her own body, abortion rights have been one of the most controversial issues in our society.
The Supreme Court said in Roe v. Wade in 1973 that women have the right to choose for themselves whether to continue a pregnancy, whether to have an abortion. But that right is meaningless if there's nobody there to provide the abortions. The anti-abortion movement has used every imaginable tool of intimidation to try to shut down reproductive health care facilities. And unfortunately, some reproductive health care facilities have just given in and closed down. It's Susan Hill who refused to do so. And not only has that helped all the women she served, but it's been a model to others through the country that they should have courage and can stand up and keep the facilities open.
I met a doctor in Florida, and he was a crazy OBGYN. I always refer to him as that. And he said, I'm going to start an abortion clinic as soon as it's legal. And I was shocked and said, it's not going to be legal. And he said, yes, it is. And about 6 months later, he called me and he said, have you heard the news? And I said, no. And he said, turn on the radio. And they were announcing that the Supreme Court had just ruled that abortion was legal in this country, Roe v. Wade. About 10 days later, we started seeing women in Florida that were absolutely desperate for legal abortion.
Hill's commitment to provide women's reproductive health services led her to open clinics in underserved areas across the country, including several in her native North Carolina.
Because we wanted to go to small towns, because I came from a small town and I didn't want to provide services in Washington or New York. They had plenty of doctors. But women in Mississippi or women in North Dakota or women in Indiana didn't have that. That's where we wanted to go, was where the access was being denied at all cost, and women were traveling 5 and 6 hours.
Susan's advocacy for women reaches way, way beyond what we actually do for them in our clinics. She has been very much involved with getting different laws passed locally and federally. For instance, here in North Carolina, the FACE bill, which she fought long and hard for, which had to do with the access to the facilities, that nobody could actually block the front so people couldn't get in.
I've really loved the legal side of abortion rights because it's been groundbreaking, it's been heartbreaking, it's had all of the things that you could want to get, and as a social worker I knew that a lot of it had to be done legally just to make it stick if we were going to do it.
I had the opportunity to work with her on a lawsuit that she was very involved in. It was a case called National Organization of Women versus Scheidler. It was a lawsuit that lasted over 20 years. It was against the most extremist parts of the anti-abortion movement.
I had friends who got us into the RICO case, which was a big case and went to the Supreme Court 3 times. And those friends had assured me that the case would last about 5 or 6 years, and it lasted 21 years. So I don't know why we hung on, but you know, once you're in, you got to stay. And so we did, and I believed in it.
Susan has risked her life by what she's advocated for. Some who were doing the same thing that she was were killed by anti-abortion protesters. She's faced countless death threats, and yet she stood up to all of them because she believed that women should have the ability to choose for themselves whether to have children.
We do get death threats regularly, and Again, after so much time, I certainly take each one of them very seriously. I make sure I look at posters if they're being sent to us of things that have happened around the country, because you never know when that person is going to be on your doorstep. Unfortunately, that is a reality for me, because many years ago, one of our good doctors in Columbus, Georgia, while he walked into the clinic, got killed.
And I said, well, who did they kill? And she said, they killed Dr. Gunn, and who had worked with us for 7.5 years. And I could hardly believe it. And I remember sitting on the side of the road for about 5 minutes and saying, it can't be true. They wouldn't do that. And she said, they did it. He just was pronounced dead in the hospital. And that was the first realization that we were in something worse than I thought it was. I thought it was protest. I thought it was free speech. You know, I didn't like it when it was at me, but I understood it, and I might want to have a protest sometime too, so I was willing to respect that. But when people that I knew or anyone were getting shot because they were walking into work, that became something different. And I was afraid for our doctors. I was afraid for our staff. I didn't know how I was going to convince the staff that they were safe, because I didn't know that they were.
If Susan Hill hadn't been here, those facilities wouldn't have been open. It's so unlikely that there had been somebody else with her courage to have those facilities open. Think then of the women who received medical care who wouldn't have had it available. Think then of the women who were able to have abortions who otherwise would have had unsafe abortions or unwanted children. Susan has protected the freedom of thousands of women, as well as their health and their very lives.
When I think about the people who wanted to, being controversial, even though I didn't think of it at the time, and people who wanted to kill me or told me they wanted to kill me, I knew that it didn't matter. That it didn't matter whether they did or not, that I would be as careful as I could be, and I have been. But that if you do what you want to do and you believe it's the right thing to do, and if something bad happens to you, it couldn't be better that you were actually somehow so committed to something that you accomplished it in spite of everybody. And if it's a shorter life for you because of that, then I'd choose it over a long life where you didn't make a difference at all. So it's never been a fear of mine that someone would get me. Like I said, I just have learned to be careful. And you can't live with fear. You can't live with fear of cancer. You can't live with fear of people who want to hurt you. If you do, you're paralyzed. And I don't want to live paralyzed. That would be a horrible way to do it.